In the name of Allah, the most gracious, the most merciful. We have here to talk about the main part of the human life. It's called sperm. What's the structure of the sperm? We have here the hypothalamus. We have the main transporter of the hypothalamus is called testosterone. Testosterone is to transport the stimulate gene RH. It's called the gene RH is gonadotropin hormone. Yes, gonadotropin hormone, which is release two hormones, two kinds of hormones. We have LH and FSH. Okay, it's released to the testes. Then we can make the sperm by combine the LH and FSH to the testes to confirm the sperm. This is the estrogen similar to testosterone, inhibits FSH secretion at AB level. We have here about the cell and nucleus. The receptor here, the receptor and the testosterone. Testosterone here is 10%. 10%, and it made together about the testosterone receptor, this receptor, to include the nucleus. Then we have here that testosterone is combined 90% here to make the testosterone to compose to the testosterone receptor. We have here the function of the testosterone. The function of the testosterone. We have the first growth of genitals in boys. Okay. The second we have production of sperms. The third we have growth of facial, pubic, and axillary hairs. Facial means it's this here facial.
Facial face.
Facial face. Oh, sorry. Pubic here. Axillary hair is the hair. So testosterone has the main function of
انما العيل الصغير اللي ما عندوش تستوستيرون وعنده شعر في راسه.
So growth the fascia and pubic and axillary hairs. We have the muscles to develop the muscle. Its growth to the larynx and voice deeper. So that's why every person has a difficult voice, because it depends on due to the testosterone. Inhibition of bones growth, thickening of skin, loss of the subcutaneous fat. That means what? That means in each day or every day the skin will be thick. Okay, so that's due to the fat is going to lose, because the thickening of the skin is appeared to every day. Behavioral changes in man in his life, for example, in his attitude to the other person. Okay, it depends on the testosterone. Nitrogen retaining effect. We have erythropoietin secretion increase, and increase the LDL and decrease the HDL. We have here some prescriptions about the testosterone preparations. We have testosterone AQ suspension. It means testosterone we have, for example, 50 to 100 milligram. That's the dose of the testosterone in the pharmacy. For example, in the pharmacy we have to sell the testosterone as dosage. This dosage about, for example, 50 to 100, and this useful for 2 weeks. 2 weeks to use 50 to 100. We have here testosterone esters. For example, we have types of testosterone esters. We have testosterone. It's 25 to 50 milligram, and it's used for 3 times in a week. Okay. We have testosterone. It's 40 to 60 milligram, and it's used to also 1 or 2 weeks. Testosterone, it's from 100 to 200 milligram, and it's used to 2 weeks also. We have testosterone. It's used 250 milligram, and it's used to 2 weeks. So this is the some of medicines we can use to the pharmacy. We can bring in the pharmacy, and any patient has a problem of for example, in the growth of the hair, in the thickening of the skin, we can use testosterone for these types. We have here, for example, already active preparation. For example, we have methyl-testosterone tab. We have, for example, polycythemsterone. We have the mysterolone. Okay. We have other type, transdermal patches. We have 2 patches per day. We can use in back, in abdomen, and thigh. Implants is whole of the abdomen or thigh. The last one we have here, the testosterone esters. Testosterone esters is about the basic testosterone esters, speed of drug release in the bloodstream, and pain at injection site caused by the esters. That means what? That means the testosterone ester is go to the bloodstream as a faster, and maybe we can use it by injection to decrease the pain of the ester. That's it.
Che avevo